Welcome to Align Your Practice, an exploration of the seamless relationship between the business of chiropractic and the future of natural health care. Join us as we engage with an array of talent, from seasoned experts to passionate new entrepreneurs. Now, here's your host, Dr. Joe Esposito.
Welcome to the Align Your Practice podcast. This is Dr. Joe Esposito. I'm excited to have a guest today, Dr. Brian Board. Brian, how are you?
Oh, doing fantastic. Joe, thanks for having me here.
You're welcome. This episode, Brian, we're going to be talking about reigniting purpose. And I thought you were the ideal person because you just spoke at a club. You're fired up. I've heard you, the fire in your belly whenever we talk about this profession, about helping people, just about, the journey that we're on. So I just wanted to welcome you, and I'm excited to hear some of the dialogue that we'll go through about purpose today. Okay. I thought, Brian, like when we get into purpose, to me, when we look at it, it's the how. It's the why. It's the why you get up in the morning. It's the why you start a business. It's the why you got into chiropractic. The why is so essential for us when we're building a business or, in fact, a relationship, personal, intimate relationship. When you have children, there's a why. When you start a business, there's a why. Any behaviors, there's always a why. And that's purpose. So the more convicted we are in our purpose, the more chance we have to gain success. And we all know the chiropractor that had this life-changing adjustment, right? From rejuvenation of their life or reduction of disease or from disability to function. It's easy to build a practice when you have that why story that strong. But the other side of it, I realized, is when we don't have the how, we don't have the system, we don't have the pathway, we don't have the course, that purpose begins to get damaged, withers, and it gets less transparent, and there's less precision on the focus around that purpose, and we start to lose ground. Since you've been at AlignLife, you've been scaling and growing. You're just such a convicted person. And I'd love you to tell a little about your story. Well, first, tell us how you got here. You've been in practice for a while. Give us a little background.
Yeah. So I have been in practice for over 23 years now. And the first 19 years of my career was spent really in a series of opening up clinics. I started out in my own practice, which I purchased from a chiropractor up in Northeast Ohio who had basically set it up and then just stepped back. So I stepped in very, very early in the life of that clinic and ran that for about 3 years as a personal injury and workers' compensation clinic, and then moved down to Charleston, where I worked in a wellness clinic with a number of massage therapists for a while. And then I spent a couple of years after that working for a different franchise and went from there to more of a kind of a holistic medical practice that was relatively short-lived, and then opened up my own mobile chiropractic service. And it was at that time that I was kind of discovered and recruited into the AlignLife family. And I have to admit, it did take a little bit of time for me to kind of come around, but I am extraordinarily happy that I did. And it's been a fantastic experience the entire time.
That's awesome. So it's interesting. You've had the wellness experience, the medical integration, the mobile. I mean, you've touched so many different types of opportunity in the industry. So you definitely have your share of scar tissue on the journey. And when we met, I knew you had some hesitation because I know you've been with other franchise groups and other models and whatnot. And I knew it took a little bit for you to warm up to the idea of unifying. When we talk about purpose, I feel energetically from when I met you to now, even the last 2 years, you are so empowered into the purpose. you're grounded more as a chiropractor, you're gaining more success. What do you feel is the gap between, it's the same purpose, right? It's not like you came out of school, you didn't want to be a chiro, or you weren't focused, right? What helped to refine and rebuild or reignite, as this podcast is about, reignite purpose?
Well, it's kind of like what you said before, where you can come out of chiropractic school with a crystal clear purpose and a drive and a vision to where you want to be. But if you don't have the systems in place that you need to guide and to focus that drive and that direction, then what you wind up doing is the passion will quickly get burned out. And I found myself getting burned out on multiple occasions, to where I was frustrated on a daily basis, that because I knew what I had to offer and I knew what chiropractic was and what chiropractic could do for people. I just had no idea how to effectively bring that message to people and to really effectively translate that message when they got into my office. So what they knew was pretty much on the ground what I was giving them at the time, but without the overall framework that I needed to make sure that I was doing everything that I needed to do to not only get my patients, physically improve their overall health, that they were going to see that on the most fundamental kind of shallow level. And then if we didn't have the framework in place to make sure that everything was being done on a granular level every single day, then the message was either going to be just not heard in the first place or completely lost.
Yeah, no, that makes so much sense. When we talk about, purpose, and you say burnout occurs. It's not the amount of work that creates burnout. Burnout occurs when we're not living our core values. So if we're doing things we don't want to do, that don't honor our values, we burn out, meaning we have less energy when we're done than when we started. So what I always loved in practice is I left my office at the end of the day with more energy than when I came in the morning. And that's because you're living inside of your value set. So first is the value set, is making sure. And one thing I'm really excited about in AlignLife is when we meet new doctors, we used to try to define success for people. This is what success looks like. This amount of money, time, and energy. And we're like, no, 2 years ago, I made the change that we're going to allow the doctor to define success based on their values. And then we decide if we can serve their definition of success inside of their value set. So it's a whole different model. And it's weird in a franchise model, because franchise is known as consistent outcomes, right? We still get the same outcome with the patient, but we may deliver in a different context to honor the doctor's values. And the last thing I'll say about that is the frustration we experience in life from where we are to where we want to go inside of our purpose. I want to have $1 million clinic. I want 5 clinics. I want to be off by 4 o'clock. Whatever it is you're trying to accomplish in your practice, the frustration occurs from where you are to where you want to go and not having a clear path to get there. I could be 400 pounds and I want to be in shape. Well, I know my purpose. I want to be in shape, but I don't know the path to get there. So in AlignLife, our goal is to find out your value set and look at the context of how we can get you to honor your values by looking at how you define success. And sometimes we even help a doctor refine success because they're caught in the success of what their mommy said, their dad, their neighbor, their teacher, their preacher, whoever it may be, define success. And they're actually living under the concept of somebody else's definition of success. I mean, how many of us have seen miserable, wealthy people, that may have money, but they have no value of the number one currency in life, which is happiness. So when you came into AlignLife, tell us kind of the journey. And I got to compliment you. You are a systems guy more than myself. And I wrote a lot of the system. I mean, you follow systems. You're speaking. You speak with such conviction. I think you're one of the better speakers we have in the organization. When you speak, it's just so refined. You're adjusting. You have so many of these skills. And the average person would think, that unsuccessful people that don't reach their potential is they didn't have the skill sets. You had the skill sets, but put it all together. Give us 3 or 4 pieces inside the AlignLife system that you felt grabbed all of your values, or I'm sorry, your strengths, and boom, allowed you to scale to one of the highest income producing clinics per square foot, the number one in our organization, which we'll talk about on another podcast about the per square foot. But tell us what 3 or 4 things helped you bring your strengths together.
Well, the biggest thing, and this is something that I've actually thought about recently, this is something that I never realized until I connected with you and you started to work with me very, very closely. One thing that I did not realize, I mean, obviously every chiropractor that graduates from chiropractic school brings different strengths to the table. Some might be absolutely excellent adjusters. Some might be absolutely excellent speakers. But one thing that I did not realize is that it's foundational. There is a foundational difference between many, many chiropractors, and we have different classifications for that. Some chiropractors are caregivers. Some chiropractors are practice builders. Some chiropractors are managers. Some chiropractors are full-blown CEOs. And to not realize this and to have that frustration to where I believed that, I've got all these skills. I've got so much that I can bring to the table. Why aren't I able to take this next level? And as it turns out, I'm a caregiver. I'm a caregiver chiropractor, which means that I'm the one that's going to be putting hands on patients, and I'm going to be educating them, and I'm going to be giving them the actual adjustment and doing all the work in hopefully a very empathetic and compassionate way. But one thing that really strikes me about what AlignLife has to offer is that the systems that we're working within, it doesn't really matter what direct kind of chiropractor you happen to be. The system itself is going to use your strength to be able to build it up in a much more effective manner, which is the whole reason. I mean, I'm working in the space that I'm in. You're right. It's been absolutely amazing to me to see the growth that we've managed to achieve in the space that we are, in the space that we're given. But that just is a solid proof of the effectiveness and the strength of having that framework, because I can tell you right now, if I did not have that system in place, then there is no way that I'd be seeing the overall level of success that I am seeing right now. So that's been the strongest thing that I've seen. Second thing is that there is an absolute feeling of family and support within the AlignLife system. And having been in Charleston for the past 19 years, this is something that I came to realize recently as well, that I know fairly well a total of 6 chiropractors in my area. I'm sure that some of that is my fault, but for the most part, chiropractors tend to be a relatively solitary lot. Yeah. So I know 6 chiropractors in the area, and 4 of them are AlignLife. So
yeah, is that crazy?
That right, and it is absolutely insane, and it's been definitely very refreshing and very reassuring to know that whatever help I might need on a daily basis with whatever it is that I have, that I know exactly who I can get on the phone to help me out and overcome that hurdle on a moment's notice. So, I mean, that's been fantastic. So awesome. those are 2 of the things that just kind of pop into my head as being very, very prominent, and really what makes a huge difference between everything that I've experienced up until now.
The first part's interesting because you said like even myself as a CEO, we want to judge ourselves. We're all about judgment, right? We judge. So I'm a visionary. And if I don't know systems, I'm not as good at systems. I would judge myself. You were saying you're a caregiver. Until you knew you're a caregiver, you was kind of like, maybe I should be a CEO. Maybe I should be this. Maybe, because we all live in constant self-judgment. And I like that, what you said, because my life purpose is to help people through self-awareness reach their potential. That's my life purpose. So it's really exciting because very commonly in franchising, the mindset is, well, I don't want to be cookie cutter. I don't want to be, And what I feel we've done really well is take the concept of systems and package it into an individualized method of deliverable, because we're all different people. Now, we don't have to answer the phone different. We don't have to run our analytics and our data different. We don't have to do the digital marketing different. We don't have to have different colors on the walls, but we have to, in AlignLife, what we've committed to is authentically honoring the human and where they sit, which what you just said made me feel like we're honoring that, which is you're a caregiver. You've scaled being a caregiver. And that doesn't mean you can't manage, because you're soon going to be training doctors, right? You're going to be doing other things over the next 3 to 4 years that are going to bring more value, but it's all within your innate genius, which is so exciting. So that was the first thing in systems. So you were able to use the systems and get scale on that. The second is family. And yeah, we live in a fragmented industry. Stereotypically, yeah, chiropractors they're more a scarcity and more fighting each other than supporting each other. And that's something I've committed my life purpose to bring together is chiropractors, is let's work together. I like the abundance mindset where, we're feeding each other patients, we're helping each other. We're not like, that's mine. I don't like the concept that we own people. We own patients. It's like, let's serve the community and make it healthier. So I do appreciate the family thing, because I built AlignLife because I want to be around people that my values. They're healthy mindset, they're proactive thinkers, and guess who? All my friends and half of my family, and I'm around chiropractors. So it's just I think it's healthier that way because we honor the same value system. You did say you worked in another franchise system, which we don't need to go into details, but is there any differences on the style or the culture between another similar business model and AlignLife?
Yeah, I mean, absolutely, because like you're saying, it's the way to be able to really effectively use the individual strengths of the doctor, whereas the franchise model that I was working with before was basically volume. It was just pure volume. Basically, get them in the door, get them hooked up, and turn them into regular clients. And the personal strengths of the doctor, that was an aside. It was an afterthought. The actual strength of the adjustment was an afterthought. There was no real training in how to use your strengths, how to talk to the patients, how to have them understand why it is that you're asking them to come in on a regular basis. It's purely a pain-based model, and really it's I'm not going to say dehumanizing, but it is devaluing. It's devaluing for the doctor, and it's devaluing of chiropractic itself for the patients, because it encourages reflexive behavior. It's like, I'm going here on a regular basis because this guy told me to, and that's it. And then the second that the person loses focus on why it is that they're doing what they're doing, then they disappear, and they've had a mediocre to bad experience with chiropractic, and that kind of sets the tone moving forward. So it's kind of interesting to see that now that I'm working with AlignLife and I have the ability to really be able to communicate with my patients, I get people that have had that experience before, and I'm able to take them to that next level and really make them understand, turn them from, maybe they're like a low level believer, but turn them into understanders and know that they are in the right place, and that coming to see me on a regular basis is what they need to do if they want to be healthy and reach their personal goals.
Yeah, it's the same thing. Isn't it interesting? The same thing we're doing with you to reach your personal goals. It's the exact message. So that's a culture of AlignLife. You're helping them reach their goals. So it's, again, you're not defining what their goals are either. Just like I'm not defining what success looks like to you. When you meet a patient, what are you trying to accomplish, right? That's what you do. And then you kind of build a plan to get them to whatever it is that they're trying to accomplish. So it's so authentic. I really love that. So really, in AlignLife, if we were to sum it up, and I know we're coming towards the close of this discussion, it's about outcome. And when we talk about purpose, we also have to talk about philosophy. And the AlignLife philosophy is we focus on outcome. Well, what outcome is it? Well, we're looking at the outcome of the doctor. What success are you looking to achieve? We have some doctors that come on that want to build 5 clinics in 5 years. We have some clinics that a woman who wants to have a child and they want to have compressed times and hire another doctor so they can have their values met. So the first question we have to the doctor is, what does success look like? What are you looking to do? And then figure out, how are you wired? And then third, what's the plan to get there? But what's interesting, and you just helped me see this realization, that culture carries to the patient. When you see a patient, you're asking them, what is your goal? What's the problem? What are you trying to solve? And then you're building a plan to get them to reach their goal, right? I mean, that's a difference of a different group that may, in chiropractic, that may be feature rich, which is come get adjusted. It's about the actual service, the adjustment. Our mindset is about the outcome. Would you agree with that as an overall differentiator?
No, absolutely. And then that's why we ask the question on the first day. We base all of our future discussions with the patient off of their personal health goals. What is it that you want to achieve that may or may not be related to the symptom that brought you in the door here today? And whatever it happens to be, if it's within our power, we're going to help you reach that goal.
That's awesome. All right, so closing up, if you're listening and you've been doing what Brian did and you've been through medical integration and wellness and mobile and all these different opportunities, you're looking for some grounded opportunity and you have some curiosity about being more of an outcome-driven clinic, which is entire healthcare is moving to. When we look at conventional healthcare, we look at the hospital networks, we have physician networks. The whole industry is moving to outcome. So we have to join on the bandwagon of looking at how do we create better outcomes for people. In AlignLife, we do the objective measurements on everything from body composition to lab work to x-ray, looking at objective outcome. Where are we? Where are we going? Measure the difference. That's the value of the future of healthcare. So Brian, thanks for getting on. I am going to bug you to get on one more, because bringing in more dollars per square foot of any clinic I've ever been part of over the last couple of months, what you've done is going to be exciting. So if you don't mind, we'll break that down in a future episode.
Love to.
Okay, awesome. Thanks, Brian.
This episode was brought to you by AlignLife Chiropractic and Natural Health Centers. If you're interested in creating your dream practice or want to know more about AlignLife, go to AlignLifePodcast.com.